And remarkably, here she is just a few days after having a brain tumor removed through her nose. Please welcome Kristen and Medical Director of the Skull-Base Institute, Dr. Harar Shahinian. And remarkable stuff. Let me first ask you, how are you feeling?
I feel really good. I think my eyes are about back to normal. I'm not as lethargic. I didn't sleep more than probably 6 hours after the surgery for the first couple days, and I wasn't even tired. So that's awesome.
And tumor-free, Dr. Shahinian? As far as you know?
Kristen is completely tumor-free now. Kristen had a tumor the size a little bit larger than a golf ball. Hers did not have number 4 on it, obviously. This tumor was doing 2 things. First, it was crushing her normal pituitary gland, which is the master gland that controls the ovaries in women, so leading to infertility. And the second, more urgent thing that it was doing is that it was stretching the eye nerves, the optic nerves, so she was rapidly losing vision. In fact, between the time she came to see me and the time she was diagnosed, she went from 1/4 of her vision being gone to half of her vision being gone. So the tumor was rapidly progressing. This first animation shows the traditional way of doing it by cutting from ear to ear, opening the skull, removing the top portion of the skull, lifting the brain, and going in and taking out the tumor that way. This is an older way of doing it with a large scar, and this is the way she had it done with a small neuroendoscope, a fiber optic scope that does not even touch the brain. It goes from underneath, takes the tumor out, and then decompresses both the eye nerves and the normal pituitary gland.
And so presumably under the old method, we're talking weeks in the hospital, I'm assuming?
Well, the old method required an ICU stay of several days, up to a week, and then a hospitalization of 2 weeks. Sometimes they went to rehab for physical therapy. In this technique, she was out of the hospital in 1 day. No ICU, no nothing, out of the hospital in 1 day.
And clearly, you look great. And this is the device you actually use to...
This is a model, yes, and basically, this is the power tool that is required to sew off the top of the skull in order to do the traditional, the old method, by taking the skull off, lifting the brain to go down to where this tumor is and removing the tumor. Instead, what we did, we used a 2.7 millimeter fiber optic high definition endoscope, and we went in through the nose to decompress the tumor without even touching the brain. We're not doing anything. The only thing we did at the end, after the tumor was taken out, because the tumor cavity is a sterile cavity, it's clean, and all of us have bugs in our sinuses. So the only other thing that we did was take a piece of fat, her own fat, from inside the belly button, and we use that to seal that space so that the clean area stays clean and is not contaminated by the sinuses.
And just for anyone at home watching, so if this is the tumor, everyone's thinking, well, how do you get the tumor out? The tumor is broken down and then sucked out in this small little portal, right? I mean, that's
correct.
That's where it's just remarkable, because you don't need to make an incision the size of the tumor. Well, Dr. Shahinian, thank you so much for sharing with us. I'm so glad you're back on your feet and feeling good.